breast vaccine. And all of us on this call, we have had some form of vaccine or not, or the other. And because without the vaccines, I don't think most of us will be alive. And if government has to pay money to buy vaccines or subsidize the cost so that we can live, why can't we patronize vaccines, breast milk, which is the nature's first vaccine? Because of what it does, delivering antibodies. Then the experts will be talking to you about all that. So I don't want to go into all the details. But we are saying that maternity protection laws must be reviewed. They should extend breastfeeding to 6 months. We want to see, when we are talking about baby-friendly hospitals, we want to see baby and mother-friendly hospitals, because babies don't walk to hospitals. So if I give birth in hospital, there must be facility for me to be able to breastfeed. In our offices too, we want to see that we can just dedicate one room for breastfeeding. And it is just, I don't think it's too much of an investment, because given the benefits of breastfeeding and breast milk, since that I'll leave to the experts to talk about. And we are also saying that we should make sure we integrate breastfeeding targets into national nutrition education, social protection strategies, and there must be a dedicated budget line for all this. And we are also thinking that whilst we are talking about breast milk or breastfeeding, we should also talk about the mothers. When women get pregnant, do they get the support they need? And recently, Ghana pledged about $6 million annually to promote maternal health in the country, to provide essential commodities that will help mothers to be healthy. When they are pregnant, they'll be healthy, well-nourished, and with the energy to be able to produce the breast milk and also to be able to feed the children with the breast milk. So this is our call, and we are hoping that all of us will join hands to say that with one voice, that breastfeeding breastfeeding is a right and not a privilege, and we must all promote it. Make sure that wherever we are, whether in the marketplace or anywhere, in the offices, hospital, everywhere, mothers must be encouraged to breastfeed without feeling ashamed or shy or being stigmatized. But they will have that exclusive space to breastfeed, because breastfeeding saves lives. Thank you very much. And I'm looking forward to a very exciting engagement this morning. Thank you all. And thank you to my great facilitators for accepting to be on this call and to tell us, to try to encourage us and give us the necessary information that we need to become nutrition champions and breastfeeding champions. Thank you very much for the opportunity. I don't know whether
very much.
I've already been introduced, so I don't have to say this is my name. So thank you very much, Pearl. Over to you.
Thank you very much, Dr. Binka, for that important opening and for your leadership in creating platforms like this one. So at this time, we'll move into our presentations. I must say we have two remarkable women today joining us. They are not only bringing knowledge, but deep experience from their clinical and policy sides of breastfeeding and nutrition. So for our first speaker today, our first speaker today is Mrs. Olivia Temple, the Deputy Director of the Nutrition Division of the Ghana Health Service. Mrs. Temple has been a strong force behind some of Ghana's national policies on nutrition, breastfeeding. She has worked across the country to ensure some policies are implemented in ways that will benefit us, especially in terms of mothers and children. Her work has helped with policies and community impact as well. So today she'll be sharing briefly with us what Ghana has in store, let me see, in terms of breastfeeding. So I would like you all to help me to welcome Mrs. Temple. Mrs. Temple, we are pleased to have you. Over to you.
Thank you very much, Pearl. My network seems to be tripping a lot. I don't know whether it's only me.
I can hear you very well, though.
Pearl, I want to say that some of my colleagues from outside Ghana
Okay.
have also joined. People have joined from a number of countries, and we are extremely grateful
Hello.
for that. So I just wanted you to welcome them also.
Okay. So for everyone joining us, you are welcome and
Oh.
we are glad you are here, both inside Ghana and outside of Ghana. You are welcome. And I hope you have a good and insightful experience today. Mrs. Temple, please, you can go ahead.
Hello.
Yes, hello.
Can
We
I
can
be
hear
heard?
you.
All
Yes,
right.
please.
Good morning, everybody. Um, I would like this morning to have a discussion with you on a critical public health issue, which is to promote breastfeeding to combat malnutrition. Dr. Binka has said a lot, and I think that it has set the pace for my presentation very well. I'll present to you on promoting breastfeeding through policy and public health programs to prevent malnutrition. The outline of my presentation entails giving an overview of the current nutrition situation in Ghana. Next slide, please. And then taking us through the current strategies and challenges and gaps with the strategies we are implementing in terms of the infant and young child nutrition programming. Hello.
Hello,
Wow.
please, we can hear you.
Hello.
Yes, I think you went off a bit, but we can hear you now.
What do I do?
Mrs. Temple. Mrs. Temple, please, we can hear you. I think she's off.
And what, Pearl, should we let
Yes.
Dr. Boating come while she adjusts herself or
Okay.
something? I don't know what we can do because there are so many people online. What do we do?
Okay.
But
Let
I
me see
don't.
if I can reach her.
Please let the next speaker come on. Then if she's able to find a place, then she can come back, please.
All right. Sorry about that. Dr. Lauren Watson. Okay, so please, Dr. Lauren, if you're on, would like you to start. Sorry everyone about that. I'm sure Mrs. Temple is having a bit of technical challenges. So our second speaker is Dr. Lauren Watson. She's a senior lecturer at the Department of Dietetics, University of Ghana, and she's also a registered dietitian with years of practical experience. She has been equipping the next generation of nutrition professionals like myself, whilst actively engaging in practice and nutrition education. And I'm sure transforming
Hello.
nutrition science.
Hello.
Yes, Mrs. Temple.
This is terrible.
So sorry, I want the second
Please,
speaker
can
to
you hear
start
me?
as we sort you out. We can hear you, but it seems you cannot hear us.
Why has the line become so bad all of a sudden?
Okay, please let's go on. Yeah, so as I was saying, Dr. Lorraine has helped to transform nutrition science into practical information that is understandable to the general public. So without much ado, I'd like us to welcome our speaker, our second speaker for today. That's Dr. Lauren Watson. Dr. Watson, please, over to you.
Thank you very much, Pearl, and thank you very much to everyone on the call for coming on board. I can see a couple of people. I want to say thank you to Dr. Binka. Kudos for all the hard work you are doing to bring out these nutrition issues and more nutrition issues to be addressed on these platforms that you make available to the stakeholders. All right, so I was hoping with the foundation that Dr. Binka set, I was hoping that Mrs. Temple would be able to give us a further build on that foundation before I come on with some of the practical aspects, but it's fine. I'm sure we'll be able to situate everything within this context. And pardon me, I would need to turn off my video also so that I would be able to have a smooth presentation. So looking at the theme for the year, I chose to focus on sustained lactation or sustained breastfeeding as a means of improving the breastfeeding situation that we currently find ourselves in this country. But before that, I just want to give us a brief overview. I'm sure you know all these already, but just a quick one of the components and benefits of breast milk. We know the water, the enzymes, the antibodies, proteins, nutrients. In fact, there's no substitutes for breast milk. The breast milk substitutes manufacturers may try whatever they can to produce what they would call a substitute, but there is actually no substitute for breast milk. Breast milk is the best and promoted and should be promoted everywhere as the best source of nutrition for our children. And there are benefits for both mothers and children. And I'm sure that with those of us on this call, we also are very familiar with the benefits, but we'll quickly run through some of them for the child, providing very good, so the best source of nutrition, decreasing the incidence of various infections, sudden infant death syndrome, building a strong immune system and preventing illness, lowering risk for non-communicable diseases in adulthood. For the mother also, there's lowered risk or reduced risk of several cancers related to the reproductive system, type 2 diabetes, high blood pressure. All these are very important reasons why breast milk or breastfeeding should be promoted and prioritized for the benefit of both the mothers and the children, and the broader community and population would also benefit from that. So let's look at some of the breastfeeding data in Ghana. From the Ghana Demographic Health Survey, the 2022 version, exclusive breastfeeding is happening for just 52.6%. We've had higher rates from I think around 2000, the year 2000, we had somewhere hovering around 60% plus, but we are dropping down here to the current rates we have now. And with early initiation, we are having just 58% of children being breastfed within the first hour. That is quite concerning. Then let's look at the duration for exclusive breastfeeding. From WHO's recommendation of 6 months, we are doing just 2.9 months. That is well below the recommended 6 months. The shortest durations are in the Western North region, the Western region itself, and of course, Greater Accra. And those feeding for the longest are in the Savannah region and the Volta region. Now, that calls for a lot of concern when it comes to promoting breastfeeding in Ghana. And especially because of the duration that is falling, I mean, the duration that is suboptimal at as low as 2.9, we want to look at what are the barriers and what are the facilitators of sustained breastfeeding in our context. Thankfully, some very recent work has been published on that looked at a systematic review, meta-analysis of the prevalence and determinants of exclusive breastfeeding in the first 6 months of Ghana. I share some of the highlights of that study with you. So there are several barriers, and I've grouped them under several headings. So for instance, with regards to the socioeconomic and demographic barriers, you have mothers who in urban settings who are more highly educated tend not to have sustained, seems to be a barrier to sustained lactation. If the mother also has 3 months of or less than 3 months of maternity leave, that also becomes a barrier, as well as single motherhood. Culturally, the lack of family support, our family systems are changing with more of the nuclear family, single parenthood, etc. So with that also comes a barrier to sustained lactation. If the partner also desires more children, then it means that the mother is going to have to stop breastfeeding earlier so that they can go ahead and have other children. There are health-related factors also. If the mother is not well, particularly mothers that are HIV positive, if infant is on admission at the NICU, of course, they won't have access to their mothers, and that also means barriers to lactation, inadequate breast milk production, which has several etiologies or several causative factors, including misconceptions about breast milk production. Then we also have the lack of access to health education that encourages breastfeeding. Especially for this particular study, they found lack of access to radio as being a barrier or contributing to not breastfeeding, mothers not breastfeeding. Then there's this problem also, which is almost widespread, where you have health workers recommending complementary feeds or counseling on complementary feeds when it's not yet 6 months, during the early months of breastfeeding. That also, mothers or studies that found that people who had that kind of counseling recommendation or counseling on complementary feeding in the early months of life tended to have barriers, so not to have breastfeeding, exclusive breastfeeding for the 6 months. Now, shortly, let's look at the facilitators from that same study. Antenatal care attendants seem to be associated with longer breastfeeding. When the mother also or family had exclusive breastfeeding counseling services, that was also a facilitator. And if the mother was involved in a support group, that was helpful. The knowledge and attitude also, people who tended from the studies that were reviewed, people who had adequate or mothers who had adequate knowledge and positive attitude towards exclusive breastfeeding also tended to be a facilitator. And then interestingly, among rural mothers, those of them who had higher education tended to be more wanted to breastfeed or had longer periods of breastfeeding compared to those who did not have higher education. Now listen, remember that in the barriers, we mentioned that women in urban areas who were who had higher education tended not to breastfeed. All right, so there are barriers, there are facilitators, and we need to look at each of these barriers and facilitators and then determine what policy and practice solutions or strategies that we would take in order to be able to improve breastfeeding and then promote it in order to have better data for our country. So let's look at some of the implications for policy and practice. We need to address the maternity leave gaps and workplace support. like Dr. Binka mentioned in her introduction. I serve on a committee in the FDA that is reviewing the LI, the breastfeeding legislative instrument. It hasn't been reviewed for several years. The last one was done in the year 2000. Now we have been reviewing this, and one of the suggestions or recommendations is that every workplace would have a breastfeeding or a baby-friendly space for mothers who have had children to be able to breastfeed. And also still, like Dr. Binka also mentioned, advocating for longer maternity leave so that the mothers can have more time with their children. Now, based on this very study also, we look at tailoring breastfeeding education for urban mothers with higher education. They were the ones who were seen not to be promoting or not to be breastfeeding their children for longer periods in the review that I presented. So we're looking at targeted strategies or targeted education for these women so that they would be able to, believe in breastfeeding and can even champion it from there. Then there's the issue of strengthening antenatal and postnatal counseling services. Actually, this whole thing would have to be a health system strengthening altogether, because if the people who are supposed to be championing and promoting breastfeeding are actually now promoting complementary feeding at the wrong time, at a time when it might be detrimental to breastfeeding or to the promotion of breastfeeding, then we need to look at how the healthcare professionals themselves can be strengthened, community health nurses, antenatal, those who work in the antenatal and postnatal services can have that kind of education that would encourage them to rather promote the breastfeeding as opposed to promoting complementary feeding too early in the life of a child. Then there is also the need to engage families and communities to support the mothers. Very often we tend to think that once a mother has given birth, it's almost like by default, or it's almost normal for every mother to be able to breastfeed. But we see that there are lots of challenges, and those challenges must be acknowledged, and then mothers supported to overcome those challenges. So in concluding, I would say thank you to all the mothers and all the champions of the mothers who are supporting them like WOMEC is doing, and supporting breastfeeding as a means of preventing malnutrition in our children and also even in our mothers. Thank you very much. I'm done. Over to you, Pearl.
Thank you very much, Dr. Watson, for that insightful presentation. We are very grateful. Please, if you have any questions, you can put it in the chat or you can raise your hand and then we'll call you. Mrs. Temple. So we can take a few questions as we wait for Mrs. Temple to be with us. I think I've sent Magdalene's hand.
Hello, good morning.
Good morning.
Yeah, thank you for the presentation. I would like to know if in Ghana we have any contraindications for breastfeeding. For example, if you have HIV, what is the recommendation for, and then hepatitis B, hepatitis C, influenza, COVID-19, if you have those conditions. And then if you have herpes simplex with lesions on the breast, what's the recommendation concerning that? And then, okay, I've forgotten the other question, so I'll leave it there. So, and then, yeah, about what's the stance or recommendation for those on drugs? Because drugs in terms of illicit drugs, and then medications, which medications are contraindicated in breastfeeding? I think if there is any documents on that, maybe you should refer us to it so that we would know. And then alcohol as well. Thank you.
Thank you, Magdalene. Dr. Barton, please.
All right. Thank you for that question. I think you are asking one very broad question, whether mothers who have the different types of infections that you prevent, and conditions that you mentioned are capable of breastfeeding, and the alcohol, all those different things. Yes, actually, if we're taking even just HIV, mothers living with HIV can breastfeed their infants, but as with HIV and all other conditions, under specific conditions of guidance and careful management. They must have a specific viral load, but all this will have to be done within the context of a healthcare facility. So I would say that yes, but it's conditional. And the mothers experiencing or faced with all these conditions, whether it's drugs or alcohol or living with HIV or other infections, must work together with their healthcare professionals to be able to can breastfeed, who may not be considered able to breastfeed at any point in time. Yeah, that's very broadly what I would say.
Okay. Thank you
Please,
very much.
can I ask a follow-up question? Sorry.
Okay.
Is there any document that has all these recommendations inside, or it's just between the patient and the healthcare provider?
WHO and other organizations have some documents on it, but you can start with WHO. Check out their website and you see a lot of guidance on what to do in some of these situations. Yes, there are guidance documents and you need to seek them out. Yeah.
Okay, thank you.
I just wanted to add that, hello, Pearl.
Yes, please go on, Dr. Watson.
And some of the issues that we have raised in concerning policy should be in a better position to also tell us whether we have guidelines in Ghana which have been customized to guide. In fact, because they do a lot of education and the hospitals, the hospital facilities now, they by all means, they must have something, and she's trying to come back on. So some of the questions, when she comes on, we can ask her after her presentation if it is not in her presentation. But meanwhile, you can continue directing your questions to Dr. Boateng. Thank you very much, Pearl. Over.
Yes, thank you, Dr. Benkai. Thank you, Dr. Boateng. So please, do you have any other questions? We can raise our hands or leave the questions in the chat. Also, if you are joining us, kindly leave your name and your organization and telephone number in the chat for us, please. Any other questions? I think I saw a hand up earlier.
No questions, no comments. Hello.
Hello, good morning.
Good morning.
My name is Pearl.
Okay, Pearl, yes.
I just want to appreciate you for the wonderful work you are doing and for putting together this meeting for us to learn from each other, and then also to commemorate the World Breastfeeding Week. I just wanted to add my voice to what had been shared, that just to encourage practitioners, clinicians, that we shouldn't just leave it at the World Breastfeeding Week. A lot more children can be saved if mothers are able to get support to do it. Breastfeeding can be challenging and mothers really need our support. So I just want to encourage all of us to keep the message of sustaining breastfeeding and providing support for mothers, not just to the World Breastfeeding Week, but throughout the year. We should give a helping hand to any mother who may be breastfeeding that will need our support. Thank you.
Hello.
Thank you very much, Miss Pearl.
Hello, Pearl.
Yes, Mrs. Temple.
Yeah, can you project the slide?
Now. Okay.
Yeah, I hope it's stable now. So next slide, please. This is the outline for my presentation. I think a few of these issues have been raised by Dr. Binka earlier, where we have been able to sustain the reduction of stunting, but there are regional disparities. While some regions have seen improvements or declines in their rates, others have seen inclines. And so we have to work on that. We have issues currently with overweight and obesity across all.
Hello. Unfortunately, I think Mrs. Temple is really having issues with her network. She seemed to have dropped off.
Can you hear me, please? My network is
Yes,
really terrible. I don't know why it
you
has
went
suddenly
off, but
gone
you're
so bad.
back now.
Yeah, please bear with me. I least anticipated this. My network just suddenly got so bad.
Please, can we suggest you put off your
So
video?
let me skip some of. So generally, these are persistent nutrition challenge.
You should please put off your video. It will help you.
Her video is off.
Okay.
Wow.
So persistently, we've had challenges with anemia, for instance, and exclusive breastfeeding has been mentioned. I will not overlabor it. And then with minimum acceptable diet, we are doing only about 22.3% according to the recently released demographic and health surveys. And then wasting, which is the focus of the project that is organizing this for us, WEMEC. We've seen incline in our wasting rates. And so we need to put in efforts. Next slide. We need to do more. We need to ensure that early initiation is done and then ensure that we do exclusive breastfeeding and continued breastfeeding. So we'll see that anemia levels are reducing across the age bands, but it's still unacceptably high. Next slide. Let's see how we are doing in terms of breastfeeding across the regions. Next slide. I might have to do it hurriedly so that I can get it done in time. And we realize that more than half of our regions are doing about 51% in terms of exclusive breastfeeding rates. But we still have a lot more to do because we have quite a number who are below or around 40%, which is not good enough. Next slide. And when we look at it in terms of the geographical mapping, a lot of our challenges is at the middle belt to the southern side. Apart from Volta region, a lot of the regions in the middle belt and the southern parts are not doing well because of exclusive breastfeeding and in terms of exclusive breastfeeding. And so we need to step up our game. What are the current strategies being implemented by Ghana Health Service? We have several strategies that promote optimal infant and young child feeding. We are trying to implement early initiation of breastfeeding, exclusive breastfeeding for the first 6 months, continued breastfeeding, and then complementing breastfeeding with complementary foods for up to 2 years and beyond. But the main strategies we are using are we have a national nutrition policy that serves or provides a framework which includes the infant and young child nutrition or infant and young child feeding strategy, which is a key nutritional intervention that ensures that we train our health workers to provide guidance to mothers at child welfare clinics and outreach points. And then during antenatal and postnatal care. The strategy also serves as a guide for interventions for optimal infant and young child feeding. We have the International Code of Marketing of Breast Milk Substitutes. I think I was told the previous person had spoken a little bit about that. I missed all her sessions. So what I intend to say is that in terms of the regulation, which is the legislative instrument 1667, it prohibits the marketing of breast milk substitutes, and specifically is supposed to regulate the marketing of breast milk substitutes to protect breastfeeding from commercial influence. We need to enforce this code to protect breastfeeding from commercial influences and to ensure that mothers receive accurate and unbiased information. We also are using the maternity leave provisions. I think Dr. Binka mentioned earlier the need to extend maternity leave from 12 weeks to 14 weeks. We've gone really far with getting it to 14 weeks. We are pushing for it to be at 18 weeks. But we have a bit of resistance from the Labor Ministry. And so we currently are still advocating that the extension that we had put before Parliament, that the duration should become 14 weeks, is passed. And then we move on to push them to move it a step further, which is 18 months. But we are doing a lot of advocacy around this. One very important strategy we are using is the Baby Friendly Hospital Initiative, which is a global initiative that is implemented by Ghana and other countries that ensures that maternity facilities provide mothers with information and skills and the support they need to breastfeed successfully. The details of breastfeeding hospital initiative, I think we all are aware, abreast with the 10 steps of successful breastfeeding issues. I do not want to take a lot of the time so that my network goes bad again, so I will not go into that. We also are implementing community-based interventions, and our community health nurses go to do advocacy, sensitization, education, and not only community health nurses, but we have even nutrition officers, disease control officers, midwives, who do task shifting and all support us in this cause to protect, promote, and support breastfeeding. We work with traditional leaders, peer support groups, to address social cultural barriers and to provide the support that are required at the community level. But then, despite all these strategies and what we are doing, we have gaps. The gaps, I think we all are aware of. One is the enforcement of the LI that exists. The enforcement is really weak. FDA introduced a QR code last year that allows anybody who sees violations or breaches to scan and then quickly report violations. But we do not have even a desk to pick up the violations. And so the QR code is there, but I think a lot of people are not even aware it's there. So implementation of the policy is hampered by our inability to enforce them. Then in terms of the code, the formula companies are always metamorphosizing in their approach. When you seal one avenue, they go through another. And unfortunately, because of conflict of interest, people fall prey to their gimmicks. And so they come to the regional level, the region says, no, we will not deal with you. They come to national, we say, no, we will not deal with you. They go to the facility, they even bypass district, go to the facility, invite our workers or our staff to a meeting in a plush hotel, give them pen drives, give them a little goodie here and there, or provide equipment, and then we fall prey to their gimmicks. And we have a knowledge deficit where even though mothers are aware of the benefits of exclusive breastfeeding or breastfeeding, some of our healthcare professionals are unable to provide the necessary support that they require. Unfortunately, we do not have enough funding to do capacity building these days. If you talk to any of our officers who are supposed to be trained in lactation management, they'll tell you we had trainings years ago. The focus on capacity building has drastically gone down. And so people do not have the required knowledge and skill. They don't have the competencies to provide the needed support that the mothers require before delivery, during delivery, right after delivery, and even before discharge. These days, the community support would require us building some level of support around the mother, but we are unable to do that because of knowledge deficit. The maternity leave issue we've spoken about, if a mother is unable to get the sufficient period required for exclusive breastfeeding, of course, it becomes a challenge. She might express, but how often or how long will that last? Practically, when I was breastfeeding, by 12 noon, I would have to rush back home because my boy would take all that I have expressed. Even though I start expressing months before resuming work, because I close late, the volumes that go, I'm unable to match the speed. So mothers have practical challenges that prevent them from doing exclusive, and we need to provide the needed support. Workplace support. Many places do not have even breastfeeding rooms. So if you take your baby to the office, you might struggle to even look for a place to breastfeed. I used to breastfeed my baby in my car. I leave the car parked under a tree with a help, and then I would have to be going periodically to breastfeed them. In instances where I even had twins, it was so much of a hassle. And so we need to have baby-friendly policies in our workplaces. We need dedicated lactation rooms, flexible hours for breastfeeding mothers. And then we need to give them sufficient breaks. They always say that you have 1 hour to come late and then 1 hour extra for your lunch period. And so people lump it together and close early, but it is still inadequate. It is the maternity leave that should be elongated, or else we should have breastfeeding rooms or lactation support rooms in places nearby our workplaces. And we have issues with social cultural barriers and traditional practices. We have worked on this for so many years, where we need to talk about issues where people introduce water, herbs. People think colostrum is dirty and so should be discarded. We've been at this for years. But still, when you look at the prevalence of exclusive breastfeeding and then the other things people give, you realize that water is being given and a whole lot of other things which should not be given is being given. One key challenge we are still faced with is the nutrition counseling services. This is supposed to be something that will help mothers get the needed support to be able to continue with breastfeeding or to even initiate breastfeeding. Unfortunately, most of the time, we are not able to do this consistently. You take a lot of our maternal and child health record books, and you see that the counseling table is not filled. And so how do we know whether the mother is able to breastfeed as expected? How do we know whether the mother is able to feed as expected? And so all this will lead to us seeing the malnutrition rates we are seeing. If you're able to do the things that we should do in terms of initiating breastfeeding, exclusively breastfeeding and continuing breastfeeding, and then introducing complementary foods timely, then we would be able to curb malnutrition. But we are unable to counsel and educate mothers properly. My line tripped again. Please, can you hear me?
Yes, we can hear you now.
Hello?
We can hear you, please.
Hello? Hey, the line is gone again.
Mrs. Temple, we can hear you.
My line is gone.
Hello, we can hear.
We can hear you, madam.
Please, can you hear me?
Yes, we can.
Yes.
She can't hear us.
We can hear you, madam, please. Oh dear. It was getting interesting.
Okay, I think Mrs. Temple is gone now. She's off the call.
She's
So
off
please,
the
if you have any questions so far, you can leave it in the chat for now as we try to get her back.
well.
And also, we would like to take a group picture at the end. So we would plead with you that at the end we'll ask you to put on your video for just a short while for us to take a group picture.
Yeah, so I suggest that she raised a lot of issues. And only those who were waiting for the guideline, and whether we had any guidelines or policies, she's mentioned all of them. And we will share, with her permission, we will share the slides also. And so that people can, as a reference material, after the meeting. So whilst we are waiting for her, I have a few issues, points that she has raised already. First of all, she said that we have the laws and codes which are constantly being violated. And there's issue around lack of awareness of all these, the existence of all these laws that are already in place. And the whole issue about capacity building, even for the health workers to push the agenda, and the issues about workplace support to breastfeed, workplace support for mothers to breastfeed, the issues about sociocultural barriers and traditional practices. One of the ones that really stood out for me is the issue of expressing the breast milk. You know, sometimes you may even express it, put it down, even if it is enough. The person who is handling it also can contaminate that breast milk and becomes a problem for the child. There have been a number of cases like that. You express it, some people may not even be able to keep it well refrigerated, or the person may not wash hands, touch the milk, feed the child, and then the whole issue, it defeats the whole purpose. So, and then she also talked about breastfeeding breaks. I remember when I was lecturing at Gimpa, I used to see students who will be walking around like during exam time. They come with somebody to support them. Is she back? Okay. I hear she's back to support them with the baby. And then they'll be walking around and this thing trying to breastfeed. I mean, it was so pathetic. I don't know whether things have changed. I hear she's back. So please, I will go on
Yes.
how you want to fill the gap. Thank you.
Yes, thank you very much, Dr. Binka. Mrs. Temple, please, you can go on.
All right. Please bear with me. I'm so sorry. So with the supports that should be provided by health systems, we need to go beyond just doing the education and counseling we are doing. Otherwise, it's not sustainable. We make progress and 10 years or so down the line, we retrogress. We need to look at sustainable approaches to ensuring that the successes clocked are maintained. Last year, we inclined just about a percentage point or two, and we need to step up our efforts. And one way of doing this is to ensure that the breastfeeding practices are integrated into all levels of care. And we have several service delivery points, and we meet mothers severally. You see them at postnatal care, you see them at antenatal care, you see them coming for services at OPD. It could even be at the ENT. The mom comes with a child that has an issue, but it's a breastfeeding mother. It is an opportunity for us all to say something about breastfeeding. We need to step up our efforts and ensure that it is integrated into all maternal and child health services. Even during sick child visits, we need to ensure that our workers are brought to speed in terms of their knowledge, their competencies and skills. We have not done refreshers, but those who were trained can mentor others, can orient others. In the facility, we could do clinical meetings and decide that in a month, maybe once or twice, we'll talk about breastfeeding. That will make midwives, obs and gynae, people, pediatricians, everybody still remember that we are promoting, protecting, and supporting breastfeeding. But if we push it to the background and only wait Can you hear me?
Yes, please.
Hello? Oh my God.
Yes, we can hear you. The network seems to be really
We
bad.
can hear you. Finish up.
Can you hear me?
Yes.
I have just 2 or 3 slides to go, so let me quickly run through. Please, can you hear me?
We can hear you.
All right. The last thing, last but one, is to strengthen our community support. At the point of discharge, if you are in the postnatal care, you should invite relatives who are in to discharge the woman, educate them on what they should do to support the women breastfeed. If she's even there with the husband, we should educate them to provide the needed support so that the woman can rest or sleep well enough so that she can breastfeed more frequently during the day for milk production to improve. And so we do not have to only focus on the pregnant woman at ANC, and then when she delivers, we focus on, we need the family and community support, even the extended family support. We need to work on all those people. We need to go to their homes if we see that they are not able to do what we are doing, and there's a problematic stepmother or grandmother or auntie, we need to go there to talk to them. Then we need to ensure that we strengthen our data surveillance system. We don't have to wait for the demographic and health service to be released for us to know that we actually are at 52 or 53 when our service data is indicating 90 something, 98, and we are deceiving ourselves. If we do not initiate on time, and at the point of discharge, we go to write in the mother's a book that we have initiated, and we record in our register that we have initiated, and then we report that 98% out of the 100 women were initiated in time. And then at the end of the day, we do the surveys and we are 58. We are deceiving ourselves. So we should be able to do quick surveys at our facilities in our districts to determine whether we are doing well. So all your facilities, you can decide that, oh, this month, let me check this one. Let me just assess a few of the mothers and see whether truly we have attained a good percentage. Then you move to the other. So where you have issues, you try to resolve. You can, now with decentralized assessment for baby-friendly hospital initiative, you have the tools. You can decide that, oh, once a while, maybe even if a quarter, you go to a major facility that contributes a lot to deliveries, and you go and assess, you see the lapses, you provide the needed support to correct it. That is the way to go. Otherwise, the story or the picture will not change. And it is affecting us support because donors are expecting to see impact. They're expecting to see improvement in our rate. So if we are retrogressing, they ask us, so all the funds we injected into this intervention, how come this is this? And we have found wondering. And so let's improve on our data capture. Let's improve on our surveillance. Otherwise, the rates will still be as they are. Now, let's look at what we can do multi-sectorally to ensure that what we are saying really works. Even though the health sector will lead in terms of counseling, BFHR implementation, and then the clinical guidance, we need all sectors. And we need other agencies. We need to work hand in hand with FDA. FDA is not resourced to be able to really enforce the code. And they are not able to apply the sanctions. So we need to support the national level to be able to do what they should do. So at the regional level, we have FDA. Health should move to FDA. Let's push, let's do joint exercises and monitor the code. And then at the national level, we push for the sanctions to be implemented. Recently, the rates were improved to about 10,000 cedis. But if you go to a formula producing company and the person violates and you charge 10,000, that is no money. It doesn't really serve as deterrent. It is even in the books, but we do not even implement it. And so there should be a scapegoat, and there should be examples made of people who violate the code. People who exhibit signs of conflict of interest should be punished or brought to book so that it will serve as deterrent. And corporate organizations, even the health sector, the facilities, we need to start providing lactation support rooms, breastfeeding rooms, where people can just move in and breastfeed, where they can go and there's someone stationed there to do some sort of counseling, telling them, oh, what, do you have a challenge? This is how you solve it. Do you know how to express? This is how you express. This is how you stop. Providing basic support. And then the media, you have a lot to do for us. Lately, you've been doing very well. A lot of health issues have been brought to them fore. But we need you to do more dissemination of accurate and evidence-based messages, and then helping us counter the misconceptions and misinformations by those who have commercial interests. Then our community leaders, we need to really go back to the community, advocate for support at all levels so that they can support. We need to go to the churches, we need to go to the mosque and harness support from our leaders. And then, as I said earlier, the ministries is not only a Ministry of Health, where we have FDA, HEFRA, and Ghana Health Service working on this. Recently, we are advocating that HEFRA puts some of the questions that we need to give accreditation as a baby-friendly facility into their credentialing tool. So if they go and access a facility before the person gets their accreditation, they would have looked for some indicators on breastfeeding to give them the accreditation. And then when they are going for reassessment each time, they look out for issues on breastfeeding. We have approached NHIA as well to see whether they can also put in some things that can help us push for breastfeeding. But we need to support Ministry of Gender, Employment and Labor Relations. Otherwise, it will be a challenge. And in the education sector, we need to ensure that our syllabus or the curriculum has updated information on breastfeeding, and they are spending enough time to train people well on such things before they come out of school. It should not be something that they see as very easy and then push to the side whilst they teach the hardcore mathematics and biology and anatomy and physiology. And we should make sure that in the education sector, we make a lot of noise on breastfeeding. Finally, what can we all do? The last slide. Thankfully, I've been able to go through this. We have policies in place, but there is the need to advocate for extension of the maternity leave. I know one parliamentarian, Xavier something, minister, MP for Adenta or Medina, he's been making a lot of noise. We have approached the CSO, civil society organizations, to support us to meet the parliamentary select committee on health so that we push some nutrition agenda across, like the sugar sweetened beverages tax being used for nutrition or health, etc. And so we need to advocate more, and then we need to push for 18 weeks. The last time we were on a joint multi-sectoral call, and the issue was raised again, and we said 18. Some people were screaming. And so if amongst us as nutrition people from different sectors, we can't agree that we do even at least 18, and we are pushing that, oh, they have tried, they've done like 14 weeks, it doesn't help. And so we need to speak with one voice and advocate for more. And we need to ensure that those who are our regulatory bodies, we support them to ensure that they enforce the code on breast milk substitutes. And then the sanctions are applied. And the quantum of the sanctions should be more than we are seeing now. Capacity building is necessary. We think that, oh, we've done this over and over again, everybody is trained. But year in, year out, people retire, people are employed. And so we need to continue doing refreshers, orientations, etc. And people have difficulty in terms of behavioral change. They can agree to what you are saying today, but tomorrow might be influenced by something. And so we continually have to do refreshers, orientations at the least opportunity. And then we have to do campaigns. Last, is it 4 years, when we did the Start Right, Feed Right campaign, ensuring that we start feeding our children right, and ensuring that we start it right and we feed them with the right things. That is to give breast milk, and then introduce complementary foods on time. We need to continue all those efforts. We do not have to shelve them. We need to continue. And then we need to engage all stakeholders and harness their support. I think that if we work together multi-sectorally, this should not be a challenge. We should easily be able to attain our goals. So I think that is the end of my presentation, and I'd like to thank all of you for bearing with me despite my network challenges. Thank you, and over to you, Pearl.
Thank you very much, Mrs. Temple. The network didn't allow, but we still heard you. Thank you very much for the insightful and very important presentation. Please, if you have any questions, you can raise your hand or leave the questions in the chat. I'll read it out for you. You can direct your questions to Mrs. Temple or Dr. Lorraine. I think I have a few questions in the chat. So this one says from...
There are questions in the chat, Pearl. Can
Yes,
you
please. I'm checking that. So this one says the first few days after delivery are key in maintaining lactation. How long after delivery can a newborn go without breast milk? Since a number of women reports breast milk comes in 24 hours. In 24 hours after delivery or sometimes 3 days. So I think the person is asking, I can't see the name, is asking how long the newborn can go without breast milk if the mother's breast milk comes after 3 days.
Okay, since my network is stable, let me quickly talk and then before it goes off. In fact, if the person says it comes in 3 days, that is not truly the case. Once the baby is born and the baby is put to the breast and signals are sent to the brain, production is stimulated and it starts. And at that time, the baby needs just about 5 meals to be full at a meal. And so even though you do not see the milk gushing out or flowing the way we see it when we say it has come in, the drops that come, which is the colostrum, is enough to make the baby full. And so the milk does not, wait for 3 days to come in. It comes in drops, but that drop is enough to fill the baby per feed. Over, so that you can have time to ask other questions.
Pearl, could I add something?
Yes, please.
Yes. When I saw the question, I wanted to say and agree with Mrs. Temple that this is where sometimes the misconceptions begin, that my baby is not getting enough food and so and so on. And before you know it, we are heading towards the breast milk substitutes. Immediately we start to do that, then it means that this baby has already started feeding. I mean, eating something that is not breast milk. But at the time, like Mrs. Timpo is saying, that amount, however tiny the amount of breast milk is, it is enough to feed the baby for then. And that's when also you want to encourage the mother to keep putting the baby at the breast as frequently as possible for that whole process of the production of the milk to get underway. If that is not done early, then before you know it, we are beginning to look at all other avenues to feed the baby aside breast milk. So it's very important that the early initiation and then the sustained lactation is encouraged and the woman is supported, especially the first-time mothers, so that they can make the best of those first few days. That sets the stage for adequate lactation, and we should encourage that. Yes, thank you. Over.
Thank you. So initiation has to be as soon as possible, early initiation. And there's another question by Desmond Tinana. Sorry, Dr. Benker's hand is up. Dr. Benker, please.
I wanted first of all to thank the presenters, and I'm hoping that those who asked earlier questions concerning policies and others, they are still around. And since Mrs. Timpo is here, they can still ask her. But my question to Mrs. Timpo is what is the strategy? What kind of strategy can be used to get all the government institutions to buy into this, because they have to lead by example. And I think the gender ministry has started, but how do we get them to buy into this to avoid this issue, struggle over the theft, who actually, because I am saying, I'm asking, so that the third one, who actually should be pushing the agenda on the workplace breastfeeding? Is it the Ministry of Health? Is it the Gender Ministry? Is it who and who? So first of all, what kind of strategies can we use? Because if government starts leading by example, whilst we push a policy to extend maternity leave, I think we should be able to take a bold step to say, look, we have to end, we set up strong advocacy around it. We should be able to do that. What can we do? And how can we avoid the issues about who actually owns, who has a mandate to push the agenda, or whether we can all work together to push the agenda? Thank you.
Okay, thank you, Director. I think that in terms of knowing who is expected to do what, it is very clear. Our mandates are very clear. We, Ghana Health Service, do implementation of the policies relating to breastfeeding. And we support ministry to formulate the policies. But the regulator is the FDA. So in terms of monitoring the code, etc., it is mainly their mandate, but we work as a team. Then in terms of ensuring that the facilities are doing the right thing, that is where we want to introduce the credentialing and accreditation questions that would include breastfeeding. That is the avenue that we see there's a missing gap that can help in terms of sustainability. But across the ministries, we have the NDPC coordinating all our sectors. And if we are meeting for their meetings, we should be able to share ideas across board. I think the linkage between labor, linkage between gender is not so strong, but linkage with education is quite strong. But in terms of changing curricula, it is a very difficult thing for GTech and others to allow us to do. So we keep advocating, we keep pushing. But then the linkage to the other influencing ministries is quite weak. And we need to strengthen that. Currently, we have the National Nutrition Partners Coordinating Committee that has all the nutrition specific actors coming quarterly to meet to discuss nutrition issues. But then we have the nutrition sensitive actors being invited on ad hoc basis to also come and help us think through certain key areas. And so that is another avenue of ensuring that we strengthen our linkages in terms of our work with other agencies. For that meeting, for instance, we have gender always participating. We have Ministry of Food and Agriculture represented by WIAD always in that meeting. There's NDPC in that meeting. I won't say that we are there yet. This thing was revamped just 2 years ago. And so we need to do more to ensure that we achieve more with it. But in terms of clearly defining rules, there are no theft wars. And we all know what we each are supposed to do, but it's just the linkage and the communication that is quite weak. Thank you, Renova.
Thank you very much, Mrs.
Hello.
Temple.
Hello. Can I come in?
Yes, yes. Kindly
Yeah.
mention your name or introduce yourself.
I'm Joseph Ayamba with
Okay,
the Group Presbyterian Hospital.
okay.
Good afternoon to you all.
Good afternoon.
I have an input with regards to the policy advocacy on breastfeeding, especially this current government as part of their manifesto. I think there's a portion of the increasing the maternity leave, which was is supposed to, they're advocating for 4 months. Then with the mandatory 2 months leave, which makes it 6 months, which is appropriate, but it's still not enforced. And this time we have a lady vice president, which is a professor and will be able to gun or work hand in hand with the gender ministry to be able to make this a law. And if we are able to push on that, it will be able to help. And the other aspect has to also do with the NGOs. Most of the NGOs don't even have the same mandatory leave with the Ghanaian laws for maternal leave, which brings much of a problem. And especially career ladies under the NGOs really struggle a lot to be able to carry this issue of exclusive breastfeeding. And it should be something that we should be able to push for it now, especially the 18 weeks. If we are able to get that on paper, then it will go a long way to help on this critical issue of exclusive breastfeeding. So I think we should be able, at least gang should be able to start the paperwork with liaison with the various institutions so that this opportunity shouldn't pass by, and it should not also be a lip service by the government as other policies which normally comes on. So I just felt we should take this into action and not just do the usual talks and move away. Thank you.
Thank you very much. And I'm sure the various stakeholders are on the call to take note of what you said as well. Rahel Kakraba, please, you can go ahead. You raised your hand.
Please, can she hear you? Oh,
I'm not sure. So there are some questions in the chat as well. Daniel Tina said, how safe and healthy is expressing breast milk for the child? Is there no loss of vital vitamins and nutrients during the process of expressing breast milk? He wants to know if the expressed breast milk is safe or if there are some nutrients lost. I think Dr. Lorraine can take this one.
Okay. Reading his question again, he's asking whether the process of expressing the breast milk is what will make it reduce the nutrients. The process itself ideally shouldn't come with loss of vitamins and nutrients. It is the handling and the storage. That's where the issues are. So ideally, if the woman is trained, wash your hands before you touch the breast, a clean vessel, a clean container to have the breast milks expressed into, that shouldn't be a problem. But it's the handling of it. If it's contaminated, that can create problems. If also the temperatures at which it is stored, particularly warm temperatures, it can encourage microbial growth, sometimes degradation of nutrients. Usually it's stored at specific temperatures for a number of days, hopefully within a week, maximum 5-7 days, the expressed milk should have been consumed. Storing for extended periods at very low temperatures could also cause degradation of nutrients. So if it's the process of expressing itself, that shouldn't create a problem. It is the handling, the storage, that's where the issues are. Yeah, thank you.
Thank you. Then the next question says, please, is there a form of extensive breastfeeding education given in the hospital before delivery or during antenatals? If no, can that be done so that at least after childbirth, mothers know how to breastfeed and the positions for breastfeeding? This is because new mothers are almost always confused because they listen to the health professionals at home. So Mrs. Temple or Dr. Watson, this person wants to know if there's any extensive breastfeeding education.
Well, I think Mrs. Timple should have been on to answer this, but from our own experiences, some of us are mothers here, we know that once we start to go for antenatal, we have this breastfeeding education and so on. But whether it is adequate or whether it is effective enough to motivate the mothers to actually do or go through the process of initiating and sustaining breastfeeding is what we would probably need some more expert opinion on. But as for the education, I think that they are doing it, but the effectiveness of it is what I'm not sure of what the data is. But looking at our breastfeeding rates or exclusive breastfeeding rates, it's likely we also have challenges with the effectiveness of that kind of education. Yeah, that's what I would say to that question. Yeah. Thank you. Over.
Okay.
L-
Thank
Let me
you
add
very much.
something to that. Let me add something to that.
Okay.
With my experience at the hospital, most of the times the education is being given, as Dr. Lauren said, the education is being given and the effectiveness is what is of worrisome. But the other challenge too with that is that they do it in the group sessions, and most of the times the attendance, especially women, most of the times come and we don't even want to sit for the education. So when they come, if you know somebody, most of the victims are even the health workers. Those who work in the same facility would just come and they are looking for the, let me say, quick services. So they won't even want to have that patience to sit down and pick the uh, education from the educators, the health educators. So that is really of a constraint which needs to be addressed at our various corners. And we should be thinking of how to address some of these challenges, especially the health staffs and health workers, and also teachers who have friends who are close to let me say, the nurses or the health workers around that side. When they reach there, you don't have the patient to sit down to also listen or participate in this educational session, but they felt we do the usual protocol thing and move out. So most of the time you meet them at the maternity during delivery or at the kids wards, and you realize that all what they are saying or what they have in mind is all informations coming from outside, but not necessarily from the health provider. And they would insist and say, oh, they were not giving any education. But when you also go to the antenatal to do cross check, you realize that at least they have sessions, educational sessions ongoing. So it's also another challenge which should be looked on. Thank you.
Okay, thank you very much. And we'll take the last question from Rahel. Rahel Kakraba. Please, you can speak now. Rahel, if you can hear me, you can ask your question now. Okay. I think we'll move on and we'll invite our host, Dr. Benka, to give us the closing remarks for the webinar.
Pearl,
Yes.
Pearl,
Yes, Mrs. Temple, I can hear you.
Pearl.
Yes, Mrs. Timpo.
I hope I have not missed any question that I should have addressed, because my line went off again. I heard my name mentioned and my lines went off. It just came back. I hope all have been addressed.
No, it was, I think you were supposed to respond to a question on the breastfeeding. Was that, it is in the chat?
Yes, someone was
Yeah,
asking if there is an extensive education for breastfeeding mothers or at antenatal care or new mothers?
Did you? Is she
I
gone?
think she's gone again. So
Please, you said, is that what?
Education. Do you have provision? Do you what? Invest in a bit on in educating the mothers when they come to your facilities?
Yes, yes. As part of the education topics at the antenatal care, we have it listed in the topics for education to take them through breastfeeding and provide the needed support during antenatal care. It is done, but not as effectively as we want it. Some people do it quite well, and they even start talking about inverted nipples and challenges with breastfeeding during that time. But then the main challenge is when they teach them at that time, when they have the babies, practical sessions are different from what they hear at the AST. And our support right after delivery is what is weak. We are supposed to continue with the education, but we do education, but not as detailed and as well as is expected. That is where the challenge is. But at those two service delivery points, we definitely use midwives and other cadres to do education. Thank you.
I think that was all. And Rachel also, she couldn't come back on, but because we've spent about 2 hours, I want to say very, on behalf of Women, Media and Change, WOMEC, and Elena Crook Foundation, and all our other partners, stakeholders that we work with, we want to say a very, very big thank you. Our great facilitators. There's a lot that we have to chew on because as a country, I think what I am getting from what I've been said this morning is that there's a lot for us to do. And sometimes I wonder that this is a free gift from God and we are not able to use it. This one doesn't need an IMF loan. It doesn't need global fund. It doesn't need anything. Just getting women to breastfeed and the children to have the breast milk. And I was very surprised when I was looking at the benefits. I was so shocked to find out that it can even prevent, it reduces the chances of developing breast cancer, ovarian cancers, and all that in women who breastfeed exclusively for a period, even type 2 diabetes. I was very surprised. And then the one that I knew was about spacing birth and all that. And then I was looking at the children's own also about the fact that even this sudden infant death syndrome, sometimes we hear that the child was born healthy before you realize the child is gone. All these, if the children are breastfed well, it can prevent diarrhea, the sudden infant death syndrome. And then what is if obesity in children, pneumonia, diarrhea, and all that, it protects us against infections and stem cell development, developing antibodies and all that. So what are we waiting for? As a country, I think we need a lot, we need to do a lot more to get to to be able to meet the World Health Organization targets. And I'm glad that this conversation has, last year we had a conversation, and as somebody said, this will not be a one-day wonder. We have to continue with the conversation that calls natural vaccine, the vaccine for us to make sure our children live healthy lives. We push it to encourage women. I heard a lot from the facilitators, and I don't want to summarize them because time is not on our side. But I just want to thank them. And one of the things that I'm going away with is also about one of the participants who contributed who made a suggestion that we should mount or step at advocacy around this whole what the maternity leave. And he said that it is well ingrained in the manifesto of the NDC. I know that I read it, but I forgot. So this is the time. And he's telling us that we should not let the opportunity pass us by. So I just want to say that this is a call to all of us. We really need to do something about it. And we at WOMEC, under our nutrition project, Nourish Ghana project, we will continue to engage with the Ghana Health Service. We really appreciate the door that has been opened to us. And of course, our one and only Dr. Boating, she was with us the last time when we had the discussion. We launched a social media campaign on nutrition. We will work with all of you to make sure that we push this agenda. I want to see us passing a law or reviewing the existing law to make what maternity leave 18 months. In other countries, the whole 1 year. If we push the benefits of it, I think government will listen. And I think this is the time for us to do that. So I want to say thank you, Mrs. Simple. Thank you, Dr. Boati, and thank you, our guests from across the globe. We have our colleague from Nigeria, Polonia. Thank you so much for joining. And all our journalists from the country who are here, and all the Ghana Health Service people, and all of you from different fields of endeavor. I want to say thank you for your patience and thank you, Susan. This is a call to all of us, and I'm hoping that all of us will become nutrition champions and breastfeeding champions. And I want to add that my own daughter also joined from all the way from Canada, and I want to say thank you for joining us. Thank you all, and have a wonderful day. And of course, our wonderful moderator, Pearl, you were just fantastic. And Dorothy, thank you for helping to put all this together. So Pearl and Dorothy, I say thank you. Thank you all, and have a wonderful day. Bye.
Thank you very much, Doc.
And I see my colleagues, we are here to answer questions. Sarah, Rahel, and all of us from the media from Ghana, and Benedicta, all of you, we are here, and I'm hoping that we'll all become nutrition champions and we can work together. Have a wonderful day, and God be with us all. Thank you.
Thank you very much, Dr. Pinka. And
Well, there's
yes,
an important question at the chat from Dude, Timothy Dude. If we could be able to address that before.
Oh, okay. Where is it?
At the chat,
let's
getting
see.
to the from Timothy Dude. It's about a child who is that. What advice should be given to a mother whose child has lactose intolerance,
Okay.
has
Yes, so the
which has been
person,
confirmed by a health professional? That's Timothy Dude from Timothy Dude.
okay,
Okay.
so any of our speakers can quickly handle that one for us. If the child is lactose intolerant, what can the mother do? Because which means the breast milk might not help.
Yeah.
Well, I will attempt to put in this comment or response. I'm happy to see that this intolerance has been confirmed by a health professional. But these situations are very rare, especially at that age. Very, very rare. And if for one reason or the other, through tests and whatever, they find that this child is lactose intolerant, then it means the child would need a formula that doesn't got lactose. And there are some such formulas on the market, and in which case the mother would have to turn to that under the guidance of the health professional. But these situations are really rare, especially for children at that age. Yeah, 0 to 6 months, they are extremely rare. Okay, that is it. Thank you. Over.
All right. I think Madame is gone, so we can't. Is she still here? Maybe she wanted to add something to it. No,
Oh, I think she's left.
she's gone. Okay. Yeah,
Yes.
thank you. So have a wonderful week. day. Sorry, and
Yes, please, we want to take a group picture. So if it's
yes,
possible
yes,
to
we should have taken it. Many people have already left, you know.
left, unfortunately.
Many people
But
have
the
left.
rest has left.
Please put on your beautiful picture. Who is taking it?
I'll take it. Dorothy
All
can
right.
also take it. Dorothy.
You can also try, both of you, please.
Yes.
Cheers to Breastfeeding Week and Breastfeeding Year. Done?
Yes, please.
All right. Thank you
Thank
all
you
very
very
much
much.
and have a good day.
Have a
Thanks.
good day. Bye.